There are many X factors, like why this in Kerala. So we decided not to release the body. We could convince their relatives that Nipah is suspected, so have to wait for a few hours. The person comes with encephalitis, then he or she should be tested for Nipah. But it's not always possible because encephalitis is common, and also acute respiratory illness is common. For influenza, for viral fevers, they are common. Literally impossible to test all the samples for Nipah, all the acute respiratory illness, the people with acute respiratory illness. It's not possible to send their samples for Nipah testing. About 9 states has the probability of occurrence of Nipah, but as I said earlier, the thing it is getting diagnosed in Kerala. That is, the system is so alert that it's getting diagnosed in Kerala. We have already started a One Health program in Kerala. There are many X factors, like why this in Kerala. The current situation in Kozhikode is totally under control. So far, 6 positive cases have been detected, and 4 of them who are under treatment. 3 of them are clinically stable, and 1 child who is 9-year-old, he was on ventilators till yesterday, but the ventilator support was removed, and now he is on oxygen support, but he is clinically improving, which is a very good sign. And we have identified 1233 contacts, and we have categorized those contacts into high-risk contacts and low-risk contacts. And the sample testing of the high-risk contacts are being done. It was back on 11th of this month that we got an information from a private hospital that 2 unusual fever cases are there, and they are siblings, and also their mother's brother is also admitted there with fever. So when I got that message over phone, I asked Director Health Services to study the cases thoroughly and also to conduct a fever surveillance in the area. So that was done, and we also came to know that their father died on 30th of August, that 10 days before. So the private hospital and our group had an interaction, and we suspected Nipah, and the samples were sent to the BSL level 2 lab in Government Medical College, Kozhikode. Meanwhile, at Thiruvananthapuram, we had a higher level meeting with myself, Principal Secretary, Director Health Services, Director Medical Education. They all participated in the meeting, and we decided to observe Nipah protocol in the district Kozhikode. And it was at that time I got a call from Dr. Anup, who is working in the private hospital. He told me that there is a broad death case is there, and at that point of time we didn't have any epidemiological link with that person and the person who died before, or the family who are under treatment with fever. So we decided not to release the body. So I asked Dr. Anup not to release the body. So and also it was decided to do the 3-layer packing, and the body was kept in the mortuary there. We could convince their relatives that Nipah is suspected, so have to wait for a few hours. And after that, in an hour, we got the results from Medical College Kozhikode. The samples we tested, the samples of the children and their mother's brother, and we found positive sample, 2 positive samples in that. So immediately the entire samples were sent to NIV Pune for the confirmatory test, that is for the declaration, and the sample of the deceased person was also sent. And we all by 12th morning we reached here, and we had a meeting at the collectorate, and the 19 call groups were formulated, and we started contact tracing, and we started identifying high risk and every other activities as per Nipah protocol. We initiated all those processes on 12th morning itself.
With this being the fourth episode of Nipah infection in Kerala and the third in Calicut, what factors do you think contribute to the recurring incidence of the infection in the state?
ICMR and WHO had conducted several studies on Nipah cases in Kerala, and we had, as you said, this is the fourth time Nipah cases are getting reported in Kerala. The first thing is that our diagnosis is very good, that no single case is left out. So in Kerala, since the system is on alert always, if such an unusual fever case is reported or unusual death is there, we have already issued a government order on the diagnosis of Nipah. Like if the patient comes with encephalitis, and if the patient has got acute respiratory illness, then the next question is that the next thing that the health workers they have to think about testing for Nipah. So what is found from the studies of ICMR and WHO is that bats, they are said as the natural reservoirs of Nipah virus. So the previous episodes of Nipah have proved that the patients got infected from bats, and each incident was different, and this time also the Intex case has some a similar type of contact with the excretion or fluids from bats. So that is the inference, and further tests have been conducted, and now also 36 samples are sent to Pune. Bat samples are sent to Pune, and we have done the genomic sequencing of these samples.
While Kerala has a robust health infrastructure of detecting Nipah cases, why hasn't the state government taken more protective measures to identify before fatalities occur?
See, we have been doing testing for Nipah. We have since 2021 episode, the case which is reported in Kozhikode, we have developed a BSL level 2 lab at Kozhikode Medical College. So since then we have been testing samples for Nipah. Hundreds of samples were tested at Kozhikode Medical College, and many samples were sent to NIV Pune, NIV Alappuzha, and also Institute of Virology, Thornikal. So this process was going on, and also the government of Kerala, the health department has issued a government order on the protocol for diagnosis and treatment of Nipah. So in the protocol for diagnosis, as I said, if a person comes with encephalitis, then he or she should be tested for Nipah. But it's not always possible, because encephalitis is common, and also acute respiratory illness is common. For influenza, for viral fevers, they are common. But even though it's common, today the central team was talking about that it's literally impossible to test all the samples for Nipah, all the acute respiratory illness, the people with acute respiratory illness. It's not possible to send their samples for Nipah testing. So it can but we have tested hundreds of samples. We have a written protocol on diagnosis. This is all done after the previous Nipah incidents.
Considering Kerala's rich biodiversity and the presence of the Western Ghats, what specific challenge does the state face preventing and managing infectious disease like Nipah?
It's not a challenge which Kerala alone faces. It is a challenge to many countries. We have previous episodes of Nipah in Siliguri. The casualty was high, and also see in 9 states. It's a study as per the study done by.
But the fourth time only in Kerala. Fourth time only in Kerala.
Yes, but This is the about 9 states has the probability of occurrence of Nipah, but as I said earlier, the thing it is getting diagnosed in Kerala. That is the system is so alert that it's getting diagnosed in Kerala. If in some other places if that happens, this is communication after the communication with the central team. They were also telling me that if an incident of or unusual death happens in some other places, they may not go for a test on Nipah. But here what we do is that we will do the Nipah testing. If the second person is also having fever, then naturally we go for the Nipah testing.
One Health is an approach that emphasizes the interconnectedness of human, animal, and environmental health. Can you elaborate on the initiative or plans to integrate the One Health concept into Kerala's healthcare and disease management system? What are the key steps being taken?
We have already started One Health program in Kerala, and as per the Ardram mission, we have a SHSRC is the nodal office of One Health. Yes, we have given training in Kila for the volunteers on One Health, and so it is a health department will be leading the entire activities, and other departments like the animal husbandry department, agriculture department, forest department, all the line departments are part of this One Health program. So we have started the project. We have asked for fund support, the financial support from Government of India for starting a One Health center in Kerala, and now central team has they told me that they are interested in helping us, and they will once they go back, they will be going forward and in finding funds to start the One Health Center here. So we have a proposal. I have already given the proposal to Honorable Union Minister Sri Mansukh Mandaviyaji when I met him in 2022. So this was one of our main requests, that we need the support from the central government to start a One Health Center. So once we get such a financial support, definitely we'll start. All other background works are done. We have the proposal. We have the nodal office is SHSRC.
Mm-hmm.
So we have conducted workshops on One Health. And last year in 2022, here in Kozhikode, we conducted a workshop on Nipah, and where all the other departments like animal husbandry department, forest department, agriculture department, and people from ICMR, they all participated in that workshop. It was conducted in Gender Park in 2022, and after that we have released we had a publication on the workshop, and based on the decisions in the workshop, we have created a calendar on the activities on Nipah, on the activities which we have to do against fight against Nipah.
In Africa, in medical reports, they're saying that there's a huge tree destroyed by people while firing, so that there's a chance of the bats virus spread or something like that.
Okay, there are many X factors. Like why this in Kerala? Definitely, one answer is we are diagnosing it. This may be happening in other parts, but maybe not diagnosed. We are diagnosing it. Then, the other X factors why these bats have viruses. Bats, the scientists say that bats, we have found RNA in bat samples, which means live virus. So it was found in 2018, it was found in 2019, and the bat surveillance were done in 2023. Also, they have found IgG. IgG means it's antibody. Antibody is, that means virus presence was there before. So one X factor is the environmental change. So it's not climatic change. Climatic change, I am telling about the environmental change, which includes everything, even the climatic change.
Kerala has experienced multiple Nipah virus outbreaks. What unique and environmental or ecological factors make Kerala susceptible to this outbreak compared to other regions?
There are many X factors. As you told earlier, the places we have many places of which are rich in biodiversity. So one of the X factors is the environmental change. Definitely the environmental change. A related factor, but still, and we can term it as a second X factor. It is a change in the pattern of rainfall. So if the summer season, we know that we will get more fruits because it's a season of fruits. Here in Kerala we have mangoes, we have some like similar many fruits are there. But because of the rainfall, heavy rainfall, which happens in summer, this bats and birds, they may not have get enough food. These are all certain assumption of scientists who are conducting bat study, bat surveillance, etc. Anyway, we are trying to identify the X factors, and as far as the health department is concerned, what we do is that we are keeping our system on vigil always. That's why we have issued a government order on the diagnosis protocol, what all things should be suspected and how it should be done. See, we have tested so many samples, hundreds of samples in our medical college Kozhikode, where we had set the BSL level 2 lab, and even before this occurrence of Nipah.